Thank you.
Chairwoman.
Okay, thank you for that. I don't think that we have any more questions, so we wanted to, oh, I'm sorry, Senator Savino, I didn't see you down there.
Thank you, Senator Young. Just briefly, I wanted to, first of all, welcome to the hearing. By the way, you have the greatest name, Corinda Crossdale. I love that. It's like alliterative. I wanted to talk about two issues. One, as you know, in 2014, we took the step of raising the income eligibility levels for SCREE and DREE. But those income eligibilities are going to expire, a sunset later this year. Would you support an extension, a permanent extension of raising those levels? As you know, many seniors, if they lose this SCREE benefit that they've now been able to obtain, are going to wind up in a scenario where they're not going to be able to afford their apartments.
I'm, of course, not an expert on SCREE and DREE, but I do know it does have a significant impact, especially the New York City area. For older adults, we work very closely with DFTA to ensure that older adults who are eligible for SCREE are aware that that benefit exists, and it has had a positive impact on older New Yorkers, and like I said, in particular in the New York City area. Good.
I also noticed that your office is going to be working on elder abuse, and I see the partners that you're working with, which is, hold on, let me put my glasses back on because I can't see anymore, OCFS and other agencies and law enforcement. Have you had any discussions with the banking industry? And I asked you this question because earlier this year, I was able to sponsor an elder abuse roundtable with some individuals from the banking industry because they're usually the first people to see this happening. So will they be part of this endeavor?
They have been part of it. I've been in the network for, it seems like, ever. We've had conversation with them over the last couple decades that I've worked in human services. Through this initiative with the enhanced multidisciplinary teams, DFS has actually had training for financial institutes to help them further be able to identify where there might be instances of financial abuse on older adults. And then what do you do with that information? Right. Who do you report that to? So that training extends beyond just saying this is what it is.
Are you including, in the city, are you including Adult Protective Services also at HRA?
They are a key component across the state of New York. A lot of referrals don't come into the aging network. The first line of defense typically is PSA or APS if you're in the upstate area. 6 of one, half dozen of the other.
Okay, and the final thing, a few years ago we were seeing, especially in the city of New York, in communities where you had large populations of seniors who were non-English speakers who were being enrolled into long-term care programs through social adult daycare programs. There was a proliferation of illegal social adult daycare centers. There was a crackdown on some of them. Some of the worst actors have been prosecuted, but we're seeing it again. And they're popping up, and you just have to go into one of them and look at them. And you know that these are not seniors who should be in a social adult daycare center. We're seeing healthy seniors, they're dancing. It's basically a senior center where Medicaid is paying for it. So I know OMEG technically is responsible for investigating, but it's critically important that I think that your agency cooperate with that because, you know, it's not just fraud, it's having an effect also on the senior centers that are licensed by DFTA because, as you know, they keep their doors open by serving a certain number of meals, and when you're siphoning healthy seniors out of that process into these social adult daycare centers, they can't compete, they lose their license, their doors shut, and then there's nowhere for seniors to go. So this is not a solved problem, it is a continuing one, and we look forward to working with your agency and others to make this, you know, fix this problem.
Yeah, I absolutely agree with your assessment. We definitely work in partnership with Department of Health, OMEG. This is definitely something that we've seen primarily in the New York City area, and we work very closely with DFTA. Anytime they receive a complaint through their established ombudsman program, we receive copies of all of the complaints and copies of the resolution, and I do share anything that comes through our agency with OMEG and DOH to make sure we all stay on the same page with this.
Great, thank you.
You're welcome.
Thank you. Assemblyman.
Hi, Director. Yeah, over here. Sorry, I switched on you. Just before we thank you for your testimony, and we very much appreciate it, I just want to echo the comments of Chairman Simberwitz. The NORCs are especially important to us, not only in New York City, but upstate. We had a chance under Steve's leadership to talk about this in our Democratic conference, and it was almost universal how important the NORCs are. So I just wanted to express that to you, and hopefully we can work towards a good resolution under your leadership and the leadership of the Chairman. Thank you.
I look forward to working with you.
Thank you, Assemblyman Havasi. Senator Serino has one more question or more.
Yes, thank you, Director Crosdale. I just have one other question with regard to the NORCs. I was wondering about the monitoring process and when did they identify that these NORCs were not in compliance? And also with a follow-up to that, have there been discussions with the NORCs regarding this as well?
This started prior to my the analysis started prior to my taking on my current position. The agency did do due diligence. They did stretch this out as long as they possibly could, taking into consideration the census data. That's how we identify the number of older adults in particular areas. They also took further into account the American Community Survey, which drills down a little bit deeper to make sure that what they were seeing in the census data was accurate. They did reach out to all of the NORCs and neighborhood NORCs and had conversations with them to further verify the data. So they spent a number of years looking at this and looking at the trends to see, are we seeing what we think we're seeing? Are we seeing a reduction in older adults in these NORCs and neighborhood NORCs? So I think the agency did a fantastic job of collecting the data before any final decisions were made. As both you and Assemblymember Zemberwitz mentioned, this is a very vulnerable population, and we want to make sure that they're well taken care of.
Absolutely. Thank you.
Thank you very much. So, Director Crosdale, I think you've heard that there is concern among the members who are here today about the proposal regarding the NORCs and the neighborhood NORCs. And I think that one of the concerns is, of course, is that we always want seniors to be able to live in the most appropriate setting. And this provides a home for them. And as we move forward, if we could take a look at that situation again, that would be most helpful, because the alternative may be placing people in a higher level of care that maybe is not necessary, and also, is more costly. So if you could take a look at it, that would be great. We thank you for your testimony today. We appreciate you being here, and look forward to working with you in the future. So thank you so much.
Thank you.
That concludes the state agency part of the testimony for today's hearing. So it's almost 2 o'clock. We've been going for nearly 4.5 hours. We have 31 speakers left to go, just so you know. And I consulted with Assemblyman Farrell, Chairman Farrell, and he agrees that we should move into this portion of the program with each participant giving 5 minutes of testimony, if you could stick to that number. Obviously, if senators or assembly members have follow-up questions, those will be entertained. But we want to make sure that everyone has the chance to speak today, and we want to be sensitive to people's time constraints. So the further you are down the list, of course, the longer you're going to have to wait. So we want to make sure that this moves along, but at the same time, we want to hear from people. If you cannot stay, you're welcome to submit your testimony, and that's an option, but we do look forward to hearing from you. So our first speaker, moving into this section of the program, is Patricia Sheehy, Legislative Committee Chair and Director of Putnam County Office for Senior Resources with the Association on Aging in New York. Welcome.
Good afternoon, Chairman Young and Assemblyman Havasi. My name is Pat Sheehy, and I am the chair of the Legislative Committee of the Association of Aging in New York, and I'm also the director of the Putnam County Office for Senior Resources. I would like to thank the Aging Committee Chair, Senator Serino, and Assemblyman Stephen Simberwitz for their dedication to older New Yorkers. Our association represents 59 mostly county-based area agencies on aging, known as the AAAs. throughout New York State. These agencies design, fund, and coordinate programs that maintain seniors in their homes to help delay and possibly prevent the need for more medically intensive and costly health care services. Our counties are seeing an ever-expanding 60-plus population in addition to complex needs of those who are 75 and 85 plus. This cohort has put an additional strain on our aging services network. In 2015, 20% or 3.7 million New York residents were 60 plus. And this was the first time in history that we've seen that number. By 2025, 51 counties will have 25% or more of their population over the age of 60. As many of you know, funding has remained rather flat for the non-Medicaid programs that serve older New Yorkers, such as those programs provided through the AAAs. The result, New Yorkers with long-term care needs end up on a waiting list for vital services such as home-delivered meals, social adult daycare, transportation, and case management. The governor's budget includes the increased funding the legislature added last year for CSE and long-term care ombudsman's program. Once again, we thank you for that increase. However, while the executive budget baselines funding for certain programs, there remains a significant unmet need. The budget proposals includes multi-year plans for a number of other agencies and sectors, yet not for the seniors, the fastest growing population in New York. The time has come for a focus and a serious investment in our aging network. The Association on Aging in New York, along with our colleagues, Live on New York and Lifespan, have developed a $177 million multi-year plan to modernize long-term services and supports for older New Yorkers. The full plan is included in our written testimony, and I'd like to just highlight a few of those initiatives. First is community services for the elderly. There are nearly 10,000 older New Yorkers on a waiting list. CSE funds are used for a wide variety of programs and services, which include transportation, adult daycare, in-home care, personal emergency response systems, and others. We are requesting an additional $15 million annually without a local match to eliminate these waiting lists. New York Elder Caregiver Support Program. We're asking for an additional $25 million annually under the Medicaid global cap to build on the existing elder care support program for Alzheimer's and dementia-related individuals and provide for enhanced services for the 4 million plus family caregivers in New York State. Elder abuse. Elder abuse is under-recognized, under-reported, and under-prosecuted. For every one case of elder abuse reported, there are 23 cases that go unreported. The Rochester-based Enhanced Multidisciplinary Team has recovered more than $500,000 for financial elder abuse victims, more than the previous 10 years combined. $10 million in funding for elder abuse is needed to expand the multidisciplinary teams statewide and to support community-based programs that work to prevent elder abuse. Aging Services Network and investment. Our Aging Services Network has relied on volunteers to deliver many of our programs and services. While volunteers are critically important, they cannot be a substitute for paid staff. Increased funding of $35 million over a 2 to 3 year period is needed to invest in this workforce. Targeted ISEP. Increased funding of $25 million will provide the AAAs with enhanced tools to target and assist older New Yorkers who are at imminent risk of Medicaid spend down and nursing home placement. We have identified a potential source of funding for this investment. Since 2006, $37 million in federal money has been drawn down by New York State using SOFA programs, that is ISEP and CSE. Yet these funds have remained in the Department of Health. These programs are the reason New York has been able to draw down these funds, and therefore we believe that these funds should be suballocated to SOFA for reinvestment in non-Medicaid aging services and programs. Programs and supports provided by the AAAs and the community-based partner organizations are an integral part of the continuum care for all New Yorkers as they age. This comprehensive multi-year, 10-year point plan will help ensure that older New Yorkers receive the services they need to remain independent. I want to thank you and look forward to working together to improve the lives of older New Yorkers.
Thank you. Senator Serino.
Welcome, Pat. It's nice to see you here. Thanks for taking the trip up. In your role at the county level, you have a front row seat as to what is needed to serve our aging population, what works well, and how we can do things better. In your opinion, both regionally and statewide, what can we do better to help individuals age in place?
I think that, the thing that we really can do is to look over this request for the $177 million modernization and provide what we're asking, because all of those initiatives will help us to have our citizens remain in place.
And that's so important to all of us. And I just have one other question. In the fall, you attended an elder abuse roundtable that I held in Dutchess County. At that roundtable, much of the discussion focused on multidisciplinary teams that are currently being used to address elder abuse in the western part of the state. And they do a great job. Many, if not all, represented that such teams could be a tremendous benefit statewide. What are your thoughts, and have the AAAs taken a position on the expansion of the multidisciplinary teams?
The AAAs are in support of the multidisciplinary teams and expansion. I'm a great proponent of them. We saw how they worked when I was regional director for the Office of Children and Family Services, and they're modeled after that. And I must say that just last month we unfortunately had a situation in Putnam County where a home health aid provider had tried to cash a check of one of the people she was taking care of, and the state police got involved, and it did have a successful outcome. But just such a case with the involvement of a multidisciplinary team and the model that has the bankers involved would be a great benefit. We're seeing more and more fiscal abuse of our seniors every day, so that would be tremendously helpful to us.
Yes, thanks, Pat, and I look forward to doing another roundtable soon. Thank you.
We are looking forward to that too, and I want to thank both you and Assemblyman Simberwitz for the work that you've been doing with us. Thank you.
Thank you, Senator. Assemblyman, have a seat.
Chairman Simberwitz.
Thank you. Thank you for being here today. A lot of thought went into your testimony and the organizations that put this package together. There's a lot of money in here over several years. I'm sure you thought about where the funds would be coming from and how we can fund this over. Some of it is 3 years, some of it is 5 years, long-term funding. Our budget is 1 year. How do you foresee us funding this request?
Thank you for that question. As I said in the testimony, we did identify that there has been money being drawn down by the state. And the way they were able to draw it down was through the CSE and the ISEP services that we do provide. And I believe that $37 million has come into the state through that program since 2006. I believe that there's approximately $7.5 million that would be available right there this year alone. So I would urge the legislature to look into that. I believe it's come through a waiver for the F-sharp program.
So you're talking about increases as opposed to cuts that
For our-
are existing. You know, for these programs, there are cuts in the NYSOFA budget that we hope that we can find dollars for first before we do a 3 or 5 year projection.
Well, I hope that we'll be able to be successful in finding both of them. I'd like to keep in mind that most of the services that we are providing are to the Medicare recipients, and that these have been New Yorkers who have lived their whole lives and paid taxes to New York State throughout that time, and I think that they are well deserving of these funds at this point in time.
Well, I couldn't agree with you more, but it's a matter of finding those dollars. Thank you very much.
Thank you.
Thank you. Okay, well, thank you so much for being here today. We truly appreciate it. Our next speaker is from AARP, Laura Palmer, Associate State Director. And following Ms. Palmer, we will have the Coalition for the Homeless, Shelley Nortz, Deputy Executive Director of Policy. So thank you, Associate Director Palmer, for being here today. We look forward to what you have to say.
Thank you very much, and good afternoon to the members of the committee. My statement will focus on 2 basic areas of import to our membership: State Office for the Aging funded programs and hunger-related programs. The governor's executive budget essentially provides level funding for SOFA's non-Medicaid funded home and community-based programs which support older people and their family caregivers. These programs are vital for keeping older people out of taxpayer-funded institutions and are a great value to the millions of caregivers in our state. The proposed flat funding is unfortunate. According to the Association on Aging in New York, which represents county offices for the aging, there is a statewide waiting list of close to 10,000 people seeking non-Medicaid funded home and community-based services through programs such as ISAP, senior transportation services, and home-delivered meals. Many counties don't keep waiting lists, and there are an unknown number of people who are eligible for these programs but who are not aware of them. New York State should make an additional investment in non-Medicaid funded home and community-based care that assists both older adults and their family caregivers. New York State's lack of commitment to older residents and their caregivers, frankly, comes at the wrong time. Our population is aging, and it leaves fewer caregivers to care for a growing cohort of frail elderly residents. A recent survey conducted by AARP New York shows that the majority of New York State voters aged 50 and over would much prefer to receive their long-term care services at home rather than in a long-term care facility. The poll shows strong support for New York to make an investment in home and community-based services that help seniors to age in place and to keep them out of expensive Medicaid funding nursing homes as well. Our recommendations are first that the budget include a $25 million investment for SOFA to eliminate these waiting lists through the Community Services for the Elderly program line. And secondly, that the budget include a $30 million investment in the SOFA Respite program to provide services to family caregivers who are in need and in crisis. These situations often arise while trying to help their loved ones to age in place in their communities where they want to be. The governor's executive budget proposal also provides level funding for NORCs and neighborhood NORCs, each at $2.275 million. While we're grateful that this funding stream has been maintained, we are very concerned that the new language intends to recapture $951,000 from program funding for the state. The new language specifies that the existing successful NORC and neighborhood NORCs that are out of compliance with outdated demographic and density requirements in the current elder law, to Assemblyman Simberwitz's earlier question, it's Subdivision 1, Section 209, will have contracts terminated at their next renewal date, either in July or in January of this coming year. This is estimated to affect 11 of the 33 state-funded NORC and neighborhood NORC programs throughout New York State. AARP agrees that state funds should only be provided to successful and effective NORC and neighborhood NORC programs. However, the compliance issues in this case are dictated by residency requirements in the current elder law, which have not been re-examined in the last 20 years. Instead of taking funds from existing NORC and neighborhood NORC services, there should be a focus on meeting the needs of an ever-growing and aging population. As New Yorkers age, an increasing number of residents are going to require the special health and social services that are facilitated by NORC and neighborhood NORC. These programs and resources allow New Yorkers to age in place, to thrive in their communities, and avoid unnecessary hospitalization and early nursing home placement. Our recommendation is that the new language in the executive budget terminating contracts with effective programs should be excluded in the final state budget. However, there should be a review of the NORC statute, including a program review of the demographics and density requirements. In addition, we recommend a $9 million appropriation to better serve this very vulnerable population. In the interest of time, I will cut short my hunger testimony. I have submitted the full written testimony, but I will say that it's estimated that 3 out of every 5 seniors facing hunger here in New York are women, and African Americans and Hispanics are twice as likely to face hunger threats than are Caucasians. Many older adults here in New York are living on fixed incomes and rely on their Social Security benefits as the main source of their monthly income. A report issued by the Assembly Hispanic Task Force this past May found some fairly alarming statistics that showed that the Latino elderly have the highest poverty rates of all elderly ethnic and racial groups in our state. We would encourage the legislature to take a look at this Assembly Hispanic Task Force report. We support the governor's hunger initiatives that include new funding and extending availability and access to SNAP benefits. The task force report shows a fairly alarming trend, and clearly it needs to be arrested. I've gone over my time, so I'll say thank you for allowing us to testify. I'm certainly happy to take any questions that the committee might have.
Great. Ms. Palmer, first, thank you for your testimony. Much appreciated. I would like to agree with you as it relates to the hunger prevention, and we have been working in the Assembly under the leadership of Assemblyman Marcos Crespo, head of the Hispanic Task Force, who is going to be pushing not only to deal with the SNAP issue, but more appropriately for us on the state level, the HIPNAP funding, and see if we can address that problem that way. So we agree with you, and thank you for your testimony here today. I do there is one question by Senator Kruger.
Thank you very much. And I had to leave and come back, so I read the other testimony from the 2 senior groups prior. No one's talked about the issue of dementia. And I'm just curious because in my district, it seems that I have a very large percentage of seniors who live on the east side of Manhattan for a variety of housing demographic reasons. And you start to feel like the issues of dementia and Alzheimer's are impacting every other senior that comes into your office for help. So I'm wondering what AARP's positions might be around the need for expanded services to seniors for dementia issues.
Certainly, we know the longer that we live, the more likely we are to be impacted by dementia or Alzheimer's or other non-Alzheimer's dementias. I think certainly some of our proposals around making sure that NORC continues to be an effective and strong support in the community, our proposals around providing robust support to family caregivers who are caring increasingly for people with dementia and Alzheimer's are going to be absolutely critical. I think providing broad supports across the board will, by extension, help people with dementia. We also offer, programming and all of the other things that AARP does. But as far as our legislative work, we stand by ready to help you with any support that you're willing to offer to New York residents living with dementias and their family caregivers.
Thank you.
Thank you. I think we're all set, so we truly appreciate your advocacy and your presence here today.
Thank you.